Hey everybody, it's me, Cupid. I have schizophrenia. Today I'm going to be going off of that list again of the medications that I told you about, that list that I got, all antipsychotics for schizophrenia. So if you guys are interested, I'm going to leave a link in my description of this video to a video of natural ways to treat schizophrenia. If you're having issues with your medication not working fully, if you are looking to go off of medication, not that I'm recommending any of you doing that stuff, going off medication or anything like that, but if you are, I do recommend taking care of yourself and doing these natural things. So yes, please watch that video. So I think these are things that everyone should know about their meds. There's so much information that I could only do 3 pills each video. So today I'm going to be doing Orap, Vraylar, and Clopixol, otherwise known as Hemozide, Cariprazine, and Zooklobenthixol, something like that. So let's get started, you guys. So they have weird names. I'm going to be making sure to put those down below so that you guys have them. Hemozide or Orep is an antipsychotic drug of the, I'm going to put this down below too because I cannot pronounce this and I'm going to try my best, but I'm going to butcher it. Diphenylbutylpiperdine class. Yeah, probably butchered it. It was discovered at Janssen Pharmaceutica in 1963. It has a high potency compared to chlorpromazine, which we've talked about previously. On a weight basis, it is even more potent than haloperidol. It also has special neurologic indications for Tourette syndrome and resistant tics. All right, so severe side effects, you will need immediate medical attention. Difficulty with speaking, dizziness or fainting, fast or irregular heartbeat, lack of facial expression, loss of balance control, mood or behavior changes, restlessness or need to keep moving, shuffling walk, slowed movements, stiffness of the arms and legs, swelling or soreness of the breasts, trembling and shaking of the fingers and hands, unusual secretion of milk. Less common or rare, difficulty with swallowing, inability to move the eyes, increased blinking or spasms of the eyelid, lip smacking or puckering, menstrual changes, muscle spasms, especially of the face, neck, or back, puffing of cheeks, rapid or worm-like movements of the tongue, skin rash and itching, sore throat and fever, swelling of the face, uncontrolled chewing movements, uncontrolled movements of the neck, trunk, arms, or legs, including twisting movements. All right, unusual bleeding or bruising, unusual facial expression, body position, yellow eyes or skin. Even more rare, convulsions, seizures, difficult or unusually fast breathing, fast heartbeat or irregular pulse, fever, high or low irregular blood pressure, increased sweating, loss of bladder control, muscle stiffness. Symptoms of an overdose are coma, dizziness, muscle trembling, jerking or stiffness, troubled breathing, uncontrolled movements. Side effects not requiring immediate medical attention are blurred vision or other vision problems, constipation, dizziness, lightheadedness, or fainting when getting up from lying or sitting position, drowsiness, dryness of mouth, skin discoloration. Less common are decreased sexual ability, diarrhea, headache, loss of appetite and weight, mental depression, nausea and vomiting, tiredness or weakness. So that is everything for Orap. Did I say that right? Orap, maybe? Something like that. Next one is cariprazine, otherwise known as Vraylar. So I think a lot of people probably have seen the commercials for Vraylar, probably heard of it before. Most commonly used for bipolar disorder, but it has also been known to help schizophrenia. So it is also known under Vraylar in Europe. So it's Vraylar in the United States and Vraylar in Europe. It is an atypical antipsychotic which is used in the treatment of schizophrenia, bipolar mania, and bipolar depression. It acts primarily as a D3 receptor and D2 receptor partial agonist, with high selectivity for the D3 receptor. Positive phase 3 study results were published for schizophrenia and mania in early 2012, and for bipolar disorder 1 depression from a phase 2 trial in 2015. It is also potentially useful as an add-on therapy in major depressive disorder. All right, so side effects. So these side effects need immediate medical attention. Blurred vision, chills, dizziness, drooling, fever, headache, inability to move the eyes, inability to sit still, increased blinking or spasms of the eyelid, loss of balance control, muscle trembling, jerking or stiffness, need to keep moving, nervousness, pounding in the ears, restlessness, shuffling walk, slow or fast heartbeat, sticking out of the tongue, stiffness of the limbs, trouble with breathing, speaking, or swallowing, twisting movements of the body, uncontrolled movements, especially of the face, neck, arms, or legs, unusual facial expressions. Less common, bladder pain, bloody or cloudy urine, confusion, decreased urine output, difficulty burning or painful urination, dizziness, fast pounding or irregular heartbeat or pulse, frequent urge to urinate, increased thirst, loss of consciousness, lower back or side pain, muscle aches, pain or cramps, nausea, seizures, sore throat, stuffy or runny nose, swelling of the face, ankles, or hands, thoughts or attempts at killing oneself, unusual tiredness or weakness, vomiting. Rare side effects, burning feeling in the chest or stomach, dark urine, difficulty in speaking, double vision, general tiredness and weakness, inability to move arms, legs, or facial muscles, inability to speak, indigestion, light-colored stools, muscle spasms or stiffness, slow speech, stomach upset, tenderness in the stomach area, upper right abdominal pain, yellow eyes and skins. Incidents not known, I don't know what they mean by that, but blistering, peeling, or loosening of the skin, confusion, cough, diarrhea, drooling, high fever, increased sweating, itching, joint pain, lip smacking or puckering, muscle trembling, jerking or stiffness, puffing of the cheeks, rapid or warm-like movements of the tongue, red skin lesions, often with a purple center, red, irritated eyes, severe muscle stiffness, sores, ulcers, or white spots in the mouth or on the lips, uncontrolled chewing movements, unusually pale skin. Side effects not requiring immediate medical attention, decreased appetite, difficulty having a bowel movement, sleepiness or unusual drowsiness, stomach pain, trouble sleeping. Less common, anxiety, back pain, belching, difficulty with moving, dry mouth, heartburn, indigestion, irritability, pain in the arms or legs, rash, shaking, weight gain. All right, so that is everything for Vraylar. So next is Zooklobenthixol, otherwise known as Clopixol. Zookopenthixol, also known as Zookopenthixol or Zooklobenthixol, is an antipsychotic agent. It is a thiazide. I'm going to put that down below too. Based neuroleptic with therapeutic action similar to phenothiazine antipsychotics. It is an antagonist at D1 and D2 dopamine receptors. Something that I did learn, and I hope that you guys are wanting to learn this, I guess. But people with schizophrenia most commonly have too high levels of dopamine, so a lot of antipsychotics will lower dopamine. That way it actually doesn't, you don't keep having hallucinations and things like that. So that's a very common cause. So when it says right here D1 and D2 receptors, dopamine receptors, that's probably what it means, is that it lowers dopamine, which I thought was pretty interesting, because it actually, high levels of dopamine actually causes quite a few things. ADHD, bipolar mania, schizophrenia, hallucinations, paranoia, psychosis, things like that. There's a lot of things that it actually causes. So one thing that I recommend is everyone to get their dopamine levels at a good level. I use Bacopa, which is really helpful for lowering the dopamine. If you guys have any other questions, maybe if you want to know other ways to lower your dopamine, I'd be willing to give you guys a list. But most recommended is Bacopa. Bacopa, just in case. Major brands of Zookopenthixol are Zistordenol, Accuphase, and Clopixol. This drug is a liquid. The compound belongs to the thioxanthines. These are organic polycyclic compound containing a thiazanine moiety. Yeah, this is all science talk. I'm not really great with this kind of science. Which is an aromatic tricycle derived from xanthine by replacing the oxygen atom with a sulfur atom. Known drug targets are Zooklobenthixol include 5-hydroxytryptamine receptor 2A, which is 5-HTP, something that is actually well known for helping people with moods. Receptor 2A, D1B dopamine receptor, D2 dopamine receptor, D1A dopamine receptor, and alpha-1A adrenergic receptor. It is known that Zookopenthixol is metabolized by cytochrome. Zookopenthixol was approved for use in Canada in 2011, but is not approved for use in the United States. Oh, that is good to know. Well, it's not approved in the United States, but I know that I do have people who probably watch from Canada, so whatever it is. So side effects include feeling dizzy or sleepy, blurred vision, dried mouth, headache, feeling shaky or restless, slowed movement, unusual or uncontrolled muscle movements, indigestion, feeling sick, nausea, or being sick, vomiting, upset stomach. Changes in weight, appetite, difficulty sleeping, feeling anxious or confused, changes in sexual ability, breast swelling or discomfort, menstrual problems, producing more saliva than usual, fast heartbeats, feeling short of breath. All right, so those are all the side effects for that medication. So I think I've talked about this previously, I am trying to get my BA in psychology. Eventually I want to get my PhD. So right now I'm actually specifically in a psychology class, which is really awesome. I've learned so much, which is also where I learned about the dopamine. I've learned some other great things too that I could share with you guys, probably in another video. But I also am writing a book that I've been writing for a long time, about 5 years. And a lot of the information I've been learning has gone in helping me write my book as well. So some great information. I think some really unique things that you would never expect to learn. I don't know. I've learned a lot about perception. Perception is a very unique thing that people don't understand. Our senses go into our perception, and everyone has different senses, and it could explain a lot of things about why people have hallucinations over why people don't have hallucinations. It's very interesting stuff. So just thought I'd share some of that with you guys. Yes, and one last thing. Perception is a personal experience. That is something that I learned. Everyone has a different perception on everything. All right, so that is it for this video. I hope you guys have a beautiful day. I hope you guys enjoyed this video. Stay beautiful, stay wonderful, stay amazing, stay awesome, stay unique, stay you, and above all else, you guys love yourselves, okay? Peace and love.